And welcome everybody. We're really excited to have all of you here today and to have this first community of practice where we can all come together and share. But before we start, I want to just say, let's take a moment to acknowledge the land on which we're joining. Today's webinar hosts and panelists acknowledge the homelands of the Indigenous people of this place we now call Canada, and honors the many territorial keepers of the lands on which we work. Personally, I acknowledge that I'm hosting this webinar today from my home on the traditional, ancestral, and unceded territory of the Coquitlam First Nation. We thank Coquitlam, who continue to live on these lands and care for them, along with the waters and all that is above and below. And now we welcome and encourage all of you to share with us where you're joining from. And you can use the chat feature just to say a quick acknowledgement, say where you're joining us from, look out the window if you've got one close by you, and just take in your beautiful surroundings. Thank you very much, Sonia.
Thank you so much, Bobby. And so while we are sharing where you are located in the chat, we also want to get a sense of who is represented in this room. You know, we have around 50 of us here, and so it's a bit impossible to do individual introductions, even though that would be lovely. So we are doing this via a poll instead. So you should see on your screen a poll with a number of questions. Where are you located? We know that there is a concentration of folks from British Columbia, Alberta, and Ontario, but you may also be joining us from places outside of that, and you can please share that with us in the chat. What best describes your sector? If you're from health, community, academic, if you're part of a policy-making body or anything else, and what best describes your engagement with social prescribing at current? And finally, there is a multiple choice question, so you can choose all that applies. What best describes the population that you are working with if you are implementing social prescribing? If there is a target population, maybe there is not one. I see lots of responses coming in. We'll give people a few more minutes to that. And please also do feel free to share more about who you are and the work that you are doing in the chat as well. And we do have one of our staff at the Alliance who will be a wonderful note taker, who will be noting down who is present in the room and some of our conversations, the highlights of our conversations as well. Okay, so I see 84% of people have participated. I'll just give everyone a few more seconds to do that before sharing the results of the poll. Okay. Oh, still coming in, last chance. And we'll close and share the poll. So I love this. There is about equal representation from the different provinces, which is wonderful. And we also have folks from healthcare, from community, a few from research, and a couple who are part of, who identify as funder, policymaker, or government. Welcome, very exciting to have you in the conversation. And many are currently implementing or planning. Some of you are involved in some similar initiatives, just not using the same terminology. And many of you are supporting in various other ways or are curious. In terms of target population, a very high number of those of you who are focused on older adults, perhaps among others, but also representation from those who are working with youth, children and families, caregivers, racialized and newcomer populations, as well as just, I assume, open to everyone in your prescribing. So thank you very much for that. And this is very exciting. I am just so pleased and delighted to see the diversity and breadth of geography and sectors and experiences that is represented in this meeting. The United Way BC, the OACAO, and the Alliance have convened this community of practice because we know that there is so much interest and so much work around social prescribing across the different regions, but the various initiatives are not necessarily connected to each other. And so we want to create a regular opportunity and space where we could overcome some of those silos, to share knowledge, to share resources and lessons learned, and to find opportunities to collaborate where we can. So true to the core value of social prescribing, we want to use this first meeting as an opportunity to co-create the shape of our time and our conversations together. So I will pass this over to Pat, who will provide an overview of the common characteristics of social prescribing.
I think you'll have to share this screen, perhaps, Sonia. Sonia, can you share the slide? Thank you. Thank you so much. And it's just such a privilege to be here today. I can't tell you how excited I am about the opportunity for us to launch the community of practice today. Sonia said at the beginning that today is stage setting. She further said that this is an opportunity for us to co-create further opportunities and create a space really through which we can convene and engage in dialogue. So I think the co-creating is really important to focus on. We are so open to doing this with you. But to get us started, we wanted to share just some common characteristics that you might find in many communities of practice. So you'll see a number of them here: sharing promising practices, creating new knowledge or information, building relationships, which we're already starting to do. I'm delighted to see all of you commenting in the chat box, exploring opportunities and the potential for cross-sectoral collaboration and partnerships. Like Sonia, I'm thrilled to see the diversity that we have represented on this first call. Most communities of practice share tools and knowledge products, learn from each other. Three other potential characteristics are discussing challenges or barriers and engaging in joint solution finding. Participating in conversations that focus on a common interest. And I think this last one is a really important one in a country as large as Canada, particularly when we see so many things happening in a fragmented way, and we want to find a way to bring us together, to be the glue that connects people. So connecting people who might not otherwise have the opportunity to interact and to share with one another. So we're hoping that some of these characteristics will kind of resonate with you. You might want to think about what you would add to this list. This is just a beginning list. It's not definitive, but it gives us a little bit of a guidepost, a guideline, and you can perhaps discuss this a little bit further in your small groups today. And with that, I will hand this back to Bobby to introduce our first speaker.
Thanks for that, Pat. A great way to set the stage for the rest of our meeting today. We thought that we would invite a couple of community connectors within our provinces in Ontario and BC. We have established communities of practice, and we wanted to, who better to speak to them than somebody who actually participates in those community practices. In BC, we have 19 social prescribing programs, and we meet monthly via Zoom. And I have to say that in my day-to-day work, it is definitely one of the things that I look forward to monthly. It's not one of those meetings that I think, okay, I go just for the sake of going, but I just find just such passion and encouragement in those communities of practice. And so today I've invited Layla Rashid. Layla is a community connector with Chilliwack Community Services here in BC. And we invited Layla to join us today to speak to us on her experience with the BC community of practice. Layla, I'll pass it over to you.
Hi, everyone. First of all, I just want to say thank you for giving me this opportunity to share my experience with social prescribing and being part of the COP. So I'm just going to start by saying how the idea of social prescribing really fascinates me. It's all about this holistic approach where everybody comes together to provide services, your healthcare provider, your volunteers, your nonprofit agency. So we all work together to provide these services. I feel it's the same idea with social prescribing. I feel it's the same idea with coming to a COP meeting. I feel like it's a platform where we can come and share our successes and struggles, and both on a local and a provincial level. I feel like also belonging to a community that share common goals and values is empowering, just to say the least. We come together to network, share resources, opportunities, engage in discussion, tell stories, all in the effort to learn and grow. So I have many, many stories that I remember from every meeting that I go to that helped me grow both on a personal and a professional level. So when I started coming to the COP, I was introduced to many, many wonderful community connectors. And I cannot name them all, but I'll name some that actually influence my practice and how I launch my program. For example, I hope these people are here, but Janice Gunn, she was pretty much the first one that I connected with when I launched the program in Chilliwack. She literally helped me launch the program. She gave me the intake forms. She answered questions over the phone and email. So very, very supportive. And I met her through one of these meetings. Also, I cannot mention Zarif when he came up with the idea of self-referral when we all needed that kind of change. And it was a game changer at that time. Also, Jada, she shared with us a strategy on how she launched a program in her community and brought up the idea of reaching out to the churches in the community, which I thought it was just brilliant. Also, Jada and I connected and collaborated to help one of our clients that the doctor is in Abbotsford, but the client lives in Chilliwack. So we both worked together to assist that client. Chloe always comes and share all the struggles. She lives in a rural area where she gotta be creative in order to provide the services that we want to provide. So she will come and tell us those struggles. And it's just very inspiring to be among these really, really passionate people. So basically, coming to a COP meeting, it was inspirational, motivational, and just a ground to learn and grow in general and connect. That was the big thing. We are all connected. We know what's happening. We are just learning from each other and growing. When it comes to the COVID part of this part of the question, literally my program was launched during COVID, October 2020. So the COVID way was the normal way for me. And when I was hired for this position, the qualification was very long, but creativity was literally the top part, because for obvious reason, because how are you going to maintain or create social connection during mandated social isolation? So that was kind of the actual struggle. So we worked very hard. We came up with ideas, and we come to this COP meeting. We discuss these struggles, and we're all facing the same barriers. And if we walk away with ideas, and sometimes we just walk away with the knowledge that we're not alone, and everybody's supporting each other. Another thing that I want to mention is how United Way modified and led by example by modifying some criteria of the program, like self-referral, which just to better serve our communities during that time. So we were told, just go out and help and do as much as you can. And that was kind of very, very cool. And my agency did the same. We follow lead, we adapted, we changed, we modified services, and we were able to be there for our community and our seniors in our community. So we were all basically united behind the idea of providing services to those who need it. And that felt good. But if I have to say one thing that I really, really enjoyed about COP, and this is, I'm just going to say, is something that we have that's called wisdom moment. These moments are when people come in and share a story, tell us an experience. And the reason I love these moments so much is something about those stories that spark something in me that is so deep that just literally kind of sometimes answer the question why I'm doing this job. It gives a purpose, a reason. So I look forward to those moments. And I feel like at that precise moment when that person is telling the story, all of us in that meeting, we feel something together, a sense of validation, a pride, like a joy. And it's priceless. And we all walk away feeling really good, even if we had a bad day or we had some struggles that week. So thank you so much. I hope I didn't take too much time, but that's all I had to say.
Thank you, Leila. It's very clear why we invited you today. Your passion and commitment comes through so clearly. Sonia, I'll pass it over to you to introduce Nadia.
Great, thank you so much. And I would like to introduce Nadia with apologies for my completely horrendous French pronunciation. But it's really, I'm really pleased to have Nadia Lavigne here, who is the coordinator of planning and community interventions at the Santé Communautaire du Témiscamingue, which is a francophone serving community health center in a rural area or region in the northeast of Ontario. And they were part of a research pilot in Ontario called Prescription Community. And it was a 18-month project with 11 community health centers that had really promising impact on clients. And we also had communities of practice throughout that time because we were starting something new. And so Nadia, over to you.
Thank you. Merci, Miguel, Sonia, for this. So bonjour, hello, Annie, everybody. So Sonia's already introduced me. It's my great pleasure to be here today just to connect with you from all over Canada. It's quite an opportunity. We don't do that often, so I'm very happy to be here. So we started with as Sonia mentioned, with a group of other centers who were getting trained. That was around 2017. To pilot an initiative. So we have 5 sites at the Centre de Santé here, and we started with the pilot in one of them. That was in 2018, and we were interrupted by the pandemic when we were rolling out the initiative in 2 more sites. So we were really excited to join the community of practice as soon as it started. Ontario is a large territory, so it's it's obviously, we'll say the same thing about Canada, but it was a great way to stay connected with others who had just started this work. And it felt, it was rare at that time because even like the social prescription was such a seemingly a foreign program, that to be able to talk freely with people without having to explain everything and just was very precious. So we also were looking forward to those meetings with enthusiasm. And we, when we were asked like what topics are coming up for you, like we would always take the opportunity to bring those forward so that we could chat with others. It was very interesting to hear how, like, say an urban center would implement the initiative as opposed to others in Northern Ontario or different areas, and we could just brainstorm, hear what people's experience were. So a lot of the themes that I saw on that first slide, like to stay connected, to bring forward topics, to share experiences, to see what others were doing, and also to keep the momentum going, because sometimes it could have been a little bit lonely if we didn't have others to share with and move forward together. So just a couple of examples of topics that we would discuss at that provincial community of practice and that helped us in our work would be like the data pathway, for example, referral tracking. Those were discussed. How do we work towards sustainability in our organizations? How do we support and onboard new champions? How, so we had some other ideas and sometimes discussed as a group what would be the best way forward. So very interesting. So I'm just going through a few notes that I was doing here. Like, so the connection for sure is very crucial to all that. And as it was mentioned at the beginning, because social prescription is so much so about connection, it just seems very, natural that we would then continue to see connections with others. And so to see it throughout the country, like I don't participate in a lot of pan-Canadian committees, so like it seems like a really rich opportunity, and obviously to see how people are doing similar things, how they're doing differently, learn about opportunities or practices that could inspire us in our work. It's exciting to think that maybe social prescription would gain a stronger voice by us meeting together. Maybe we have needs and challenges in common. Maybe we want to run a campaign together or grow some other pilot projects, or maybe do some research or advocacy, who knows, like down the line. But if you don't talk to each other, then we know that nothing of that sort, like it would just, there wouldn't be the opportunity to create that. And it seems it's cool because when we were setting up to do all this, we had mentors from England, and I see Marianne is here. I don't know if anyone else was able to join, but it's great to see her. And we heard about a social prescription network or minute or something on social media where people internationally were meeting to discuss whatever it was that their themes were. So all in all, just very positive. And yeah, we didn't hesitate to join the community of practice, and really looking forward to hearing from others and what you're doing. So thank you for this opportunity. Merci beaucoup.
Thank you so much, Leila and Nadia, for so generously sharing your stories with us today. Nadia, you talked about the fact that it could have been a little bit lonely if there hadn't been other people to share with. And one thing it reminded me of in terms of learning is that our learning multiplies when we share that learning with one another. So I like that concept. What we'd like to do for the next 10 minutes is give everyone who's on the call today an opportunity to weigh in. As we said right from the beginning, we really want to co-create the shape of this community of practice with you. So we're going to assign you to breakout rooms for 10 minutes with two main questions. What would you like to gain from this interprovincial community of practice? And how can you contribute to the community of practice? Perhaps in that conversation, you can also think a little bit about how we can achieve those goals. So in each group, you will be invited to have somebody be the facilitator who will feedback for just 1 minute when we come back together as a large group, and someone who can be a note taker. And as Sonny mentioned at the beginning, we won't be tape recording this particular part of our session today. So those notes and the facilitator feedback will be really important. I believe we will record just the facilitator feedback when you come back to the larger group. So with that, we're going to assign you to groups and enjoy your conversations with one another.
We're going to take a few minutes now just to report back on what you heard. So hopefully you assigned somebody within your group to report back and took some notes. So we have two questions. What would you like to gain from the COP, and what can you give back to the COP? So we'll start at the top and ask breakout room number 1. Can you report back some of the conversation you heard?
I think that was my group. Sorry, I didn't look at my number carefully. I think I saw one on the way by. Sorry, I de facto made myself share. I hope that was okay with my group. What we would like to gain generally was a lot of information sharing. A lot of people were talking about just wanting to hear about other people's models and other people's programs. There was one person who shared that they spent some time trying to get their program off the ground, and they're having more difficulty doing that, and wanted to hear more about how other people are making that happen. How do you approach social prescribing in general, and what those referrals look like between organizations, what those interactions look like between organizations, the different models people have, how to advocate for more funding. So it's generally hearing other people's processes, what they've learned so far, and how you make it happen. And then in terms of how we can contribute, there's a lot of varied expertise in that group. There were a lot of healthcare workers in particular in my group, and everybody talked about some of the different levels of expertise that they could share, their research expertise they could share, which was of particular interest to me as someone who's getting into some research but hasn't done it before. Yeah, there was mostly people being willing to share their health expertise in that particular group and their own stories of how their programs are going.
Thanks for that, Vanessa. And I'm also going to acknowledge that many of you probably don't know which breakout room that you were in. So Sonia is able to see that, so she's going to help guide us. And we're going to go to breakout room 2 now. Sonia, who's
Which
in that
would
room?
be Abram, Beth, Nadia, Sharon, and perhaps a few others. Someone
Breakout
from the
room
group?
2?
Sorry,
Anybody?
it's Abram here. I think Nadia was taking our notes, but I'm seeing that she's having some internet connection issues. I think the main themes for us is that we're all looking to learn from the other groups that are attending and building our knowledge around social prescribing. And then in terms of what we can contribute, I think we have varying levels of expertise around social prescribing, with some of us fairly new and hoping to build some expertise and skill over time that we can contribute, and then others having more experience with it and bringing that expertise to contribute. Thanks.
Thanks for taking that on, Abram. Breakout room 3.
That was us. I think that's at least what we've discussed. So most of the things were definitely the same. For everything that we thought we could gain from it, I think we also thought we could contribute. Knowledge sharing, challenges and successes, not wanting to reinvent the wheel, building on and sharing passion for the work, understanding how we can scale up either within province or interprovincially and nationally. And then for contributions, as I mentioned, somewhat the same, sharing everything above, contributing your personal experience and knowledge on closed projects. Core as a resource that we learned about. I think that there's a core in BC and one also nationally. And that was when we talked about having somewhere to house information and documents that were already being used. And somebody, I could probably put that in the chat box. I know that I think it is in the chat box somewhere. And yeah, learning, lots of learning from other provinces.
Thank you, Mila. Breakout room 4. Sonia will help us if we need some help on who was there.
I think that was Chloe,
Yeah,
Marianne, Rob.
That was our group. Stephanie just said she had to step away, and she was the one that recorded. So I get to wing it, and then the rest of the people that were in my group can just tell me if I captured it all right. So really, what we're all excited about being in a collective where we can share ideas and learn from each other. We learned actually in that short period of time. And the other thing is we're really kind of disappointed we were given such a short amount of time, Sonia. So I'm just telling you that up front that, we would have liked more time. We're all excited for the fact that we're doing similar things in different communities and different geographic locations, different systems, but we're encountering similar difficulties and also similar good ways of working together. There are people in our group that had actually gone to their own geographic locations to help each other out. So I think we're all relishing the opportunity to work together and learn from each other. Is that close?
Thanks, Rob.
Thank
Anybody
you.
from group 4 wanted to add anything more? I'm sure Rob captured it all for you. Group 5.
I think that's my group. Is that right, Sonia?
That is right, Jackie.
Thank you. So at first, I'm sorry, I forgot. I want to pick up on Rob said. We too didn't have enough time because we were still talking when everything went black and we all had to come back into the session and the main session here. So we didn't get a chance to choose a note taker. But through secret message on the chat thing, somehow I got nominated. So here goes. What I heard from our group, and we stretched from BC, Calgary, and Ontario, was three of the members did have some version of social prescribing. All of us saw the value in it, even those who are just exploring it for their first take. The other interesting thing that we all saw the value in the knowledge sharing and the transfer of how we might be doing, what we can learn. The other thing I thought that was of really interest is that we had, where I'm from is just, we serve the general population, just anybody that comes. One of the members on our group serves seniors. The other one is in a rural mission, BC. And then we have one from Age Friendly Calgary. And so we were coming at it from a different perspective with a different population that we serve, but all of us see the great value in being able to share what it is that we're doing and to pick up from what others are doing. Without repeating what everybody else has said, we all are very thankful that we're here at this community of practice, and look forward to how it's going to play out. So,
thank you, Jackie.
Yeah.
Group 6.
Group 6, if you need some help, there was Melissa Smith. I'm just gonna call on you because I know you. And who's the speaker for your group? Is it you?
Yeah, it is. So we chatted a lot about similar things. I think, again, I want to also just express gratitude for coming together. I think we really spoke about sustainability. I think one of the things that I found also was talking about how to support rural communities. I think also about understanding what's currently being done and how the best practices around that and what can be taken up potentially by other partner organizations. And also the interest in being able to connect, if like for myself, I'm from an arts and culture space, to actually connect with healthcare folks is really key. We also talked about what we could bring to the table. So Ida mentioned being able to support mindful moments for all of us, which just is amazing because they're a wellness coach, but also bringing knowledge of communicating with your rural communities, particularly around older adults in our group. And also for me, partnerships and being able to connect with other cultural sites, which I'm sure Jacqueline and Vanessa also shared as well in their groups. Did I miss anything, anybody from my group there? Brilliant. Okay. Yay. It's great to be with all of you.
Thanks, Melissa. Group 7.
Hi, everyone. Sorry, my camera's not working today. So our group, we had 2 of us who are just starting into social prescribing, someone who has had some really good experience. So really our hope is to just kind of glean and learn as much as we can from those people here that have the experience and have tried a bunch of different things so that we can be effective as we move forward to implement a social prescribing model that hopefully works for that population that really needs it.
Thanks, Robin. And last but not least, group 8.
That was us. We had kind of a split of some BC folks and some Ontario folks from various kind of spaces and places. But basically, I think to echo a lot of what's already been said, we were talking about kind of bringing our various lenses and expertise and insights from the different sectors and spaces that we work in, as well as the different timelines that we're all in relation to social prescribing, whether it's social prescribing specifically or a different version of kind of community service support that looks like it, but isn't necessarily called it. In terms of things that folks would like to gain, it's kind of around the sharing of similar challenges like referral source pathways and things like that kind of transcend our provincial boundaries. Interest around research and gaining new insights on it, overlapping between other programs and names, as well as learning more about a community of practice process and actually how to best gather insights across our different locations. And then in terms of what people can bring, really looking at kind of those key knowledge keepers from various contexts and hoping to apply those insights accordingly, like bringing the health people into the spaces with the community people and leveraging those insights. In addition, Bobby, they were looking for whether or not this would be a space to be sharing contacts and ways to keep in touch with one another. So thinking about contactless spaces like CORE, how we might be able to keep in touch with folks and maybe connect or leverage that. Someone in my group was talking about Nanaimo, and I know Chloe has some insights from Gabriola and different things like that. So thinking about those things, even though not everybody may know each other in the room.
Fantastic. Thank you so much for that, Emily. And yes, I think this is all great information. It's certainly about things like sharing contacts so you can continue to connect is going to be an important outcome of why we're coming here today. And with that, Sonia, I'm going to pass it back to you to take us out.
Thank you so much, Bobby, for facilitating that and for everyone for sharing. It's just really fantastic. I'm so excited, and I hear you, Rob, but this really could have been a 2-hour conversation. And so, but not to be, I think not to be deterred, we have, this is the first of, I hope, many conversations to come. I did hear a lot around resource sharing, how much people appreciated being able to be connected and talk to each other and to learn from each other. And I did hear core being mentioned a couple of times. So we will explore an option to a place where we could share resources with each other, share those materials, share the research, and all of those things. So we will explore that and more to come around that. We are also hoping to hold quarterly meetings. So this is the first. And so over the new year in 2022, we're hoping for a January, April, July, October schedule. So around every 3 months to gather together, and we will take all of your thoughts and insights that you provided today into how we structure our meetings and what we focus on. And on that, if you have notes, if you were taking notes for your group, please share them with us at communications@allianceon.org, and we'll put that in the chat too, so that we can provide just more in-depth insights into what was talked about in your meetings. And we will also summarize this meeting and some of our next steps over email to everyone who was able to join us today. So thank you so much. I think unless if there's any last thoughts from Bobby and Pat.
I think for me, Sonia, oh, sorry, go ahead, Bobby.
No, you go ahead, Pat, because I was just going to see if there's any questions from the group that we could answer before we sign off.
Let's do that first, then see if there are questions. We just have a couple of minutes left.
Yeah, just if you do have a burning question or a comment that you would like to share, just using the chat or sorry, the raise hand. Jacqueline, I see you've got your hand raised. Go ahead.
Hi, just wondering if we could set up some kind of centralized database of all the members of this community of practice. So talking about resource sharing, I think knowing where everyone works and what everyone does will help me know who to reach out to for that.
Thanks, Jacqueline. Yes, I think we can go ahead and do that. And maybe I'll just put out, if there's anybody who does not want their contact information shared with the rest of the group, please reach out to us directly and we won't do that. But otherwise, I think we'll create a contact sheet and we can share that with everyone.
I hate to say this because it's going to be more work for me, but do people here use Slack? Like, we could set up a Slack group for this group to communicate as well if you want, rather than just send emails all the time.
Sure. We'll look at different, thanks for that, Rob. Slack is definitely one way, but maybe we'll brainstorm and we'll come up with a couple of options and we'll see which one works best for everybody.
Great.
May I shamelessly share 2 links to programs that are virtual that would love people to attend from the Art Gallery of Ontario? Is that okay? Shamelessly in the chat for everybody, for older adults and for—
Go ahead, Melissa.
Great. So thanks, everyone.
Any other comments or questions? This is great. We will follow up with the notes, but also next steps, including communication methods. All right. Thanks, everyone. Pat, I'll pass it back over to you.
Oh, thank you.
Thanks, Bobby. I was just going to kind of reinforce what everyone has been saying and what Sonia said about my excitement with today's launch. I agree, it could have been a 2-hour conversation, but I think it was a fantastic first step. And thank you so much to everybody for your willingness to participate. So I look forward to seeing you in January.
And Marianne, I saw you waving, and I would be remiss in not giving you a bit of space if you wanted to say hi to everyone. And Marianne from the UK. Hello, Marianne.
Hi, greetings from the United Kingdom. for those of you that haven't met me, I'm a GP in the UK, absolutely passionate about social prescribing, with already strong links with Ontario and now others of you as well. And it would be an honour to be an honorary extra to your community of practice. And if I can support, inspire, learn from all of you, because social prescribing is the most transformative initiative I have ever seen in 32 years of being a doc.
Thanks, Marianne. Sonia, back to you.
Hey, thank you, everyone. I feel there's lots of things happening in the chat and in the conversations of people just eagerly wanting to know when to have the next conversation and how they can connect with each other, which is just really fantastic. So we will take that energy and we'll follow up with all of you, and look forward to chatting again in January. We will confirm dates and times and join links and how we can connect with each other in follow-up over email over the next a couple of days or so.